Hi, we're Team H, and we will be discussing third-party payer considerations. I will be beginning this video by reading the scenario. Natalie Hawkins, the pharmacy manager at Good Service Pharmacy in Chipton, Iowa, opens her email and sees that Better Health Insurance has sent a new contract. Natalie has heard about the possibility that Better Health might stop using the average wholesale price, or AWP, as the basis for their prescription drug reimbursement. She was anxious to see what Better Health was going to use as their basis for their new reimbursement formula. Better Health is one of the pharmacy's major insurance plans, providing prescription drug coverage for 30% of their patients. Since Better Health significantly decreased their reimbursement rate a few years ago, Natalie worries about the effect of further decreases. As she reads the new contract, she discovers that Better Health is switching from an AWP-based reimbursement formula to a wholesaler acquisition cost (WAC) formula, and the new reimbursement rate is WAC plus 2% plus a 95-cent dispensing fee. Natalie has no idea how the new reimbursement rate compares with the old reimbursement rate of AWP less 18.48 plus a $1.25 dispensing fee. She worries that the insurer is just trying to decrease the reimbursement. Natalie wonders whether Good Service Pharmacy should still participate in the Better Health plan. After all, what signal would she be sending to other insurers and pharmacy benefit managers, PBMs, if she accepts a lower reimbursement rate? Good Service Pharmacy might become Poor Service Pharmacy, or even go out of business if all of its third-party contracts had such low rates. Then Natalie remembers Mrs. Anderson, a 78-year-old woman with Better Health Insurance, who has been coming to her pharmacy for over 20 years. Natalie has spent many hours over the years talking with Mrs. Anderson about her medications, and she cannot imagine having to tell her that Good Service Pharmacy no longer accepts her insurance. Natalie also worries about the financial impact of losing 30% of her patients if she declines the contract. As the pharmacy manager, Natalie knows that it is her responsibility to make a decision about the contract. But as a new manager, she worries about how to make an informed decision that balances the financial needs of the pharmacy with other considerations. Natalie wonders the following points.
How much will the change in reimbursement affect the net profit on an average Better Health prescription? Will the pharmacy lose money on each prescription it dispenses? How will moving away from a WP-based reimbursement formulas affect pharmacy profit?
The average net profit comparison showed that the average decrease in net profit from the change in reimbursement would be $1.73. The pharmacy is currently losing money on each Better Health prescription they dispense, but under the new reimbursement rate, the pharmacy would lose even more, an average of $4.25 on each Better Health prescription.
Would Good Service Pharmacy be better off financially by accepting or declining the contract? How do you determine whether it is worse to accept a low reimbursement rate or lose about 30% of your prescription volume?
The results from both the differential analysis and the pro forma analysis show that the Good Service Pharmacy would be better off financially by accepting the contract. Although the level of net profit in either case would be less than the current level of net profit, the pro forma analysis shows that net profit, if the pharmacy accepts a contract, would be $106,745, which is more than the net profit if it declined the contract. In this case, losing 30% of the pharmacy's prescription volume is worse than accepting a low reimbursement rate. The reason for this result is the high percentage of fixed costs in the prescription department. If the pharmacy is willing to make changes to reduce its fixed costs, such as reduced pharmacy hours or technician hours or staffing hours, then the pharmacy might be better off declining the contract. A pro forma analysis is a projection of what the income statement for the pharmacy would look like if the contract is accepted or rejected. Here is an example of how to conduct a pro forma analysis. Let's use a current scenario and look at the Better Health contract. Step 1. Accepting the contract. By accepting the new contract, the only thing that changes is the amount of prescription sales. Look at the total number of prescriptions, which is 62,868, and look at what percentage of those were from Better Health customers, which is 18,860, which is about 30% of the total prescriptions. Determine the decrease in prescription sales by using the calculated average net profit comparison and multiplying it by the number of Better Health prescriptions. So we have 18,860 multiplied by $1.73 gives $32,628. Step 2 is to construct a decline better health contract scenario. By declining the better health contract, the prescription sales, the cost of goods sold, and the operating expenses will all decrease. Each variable would need to be individually calculated. After calculation, step 3 is to compare the accepting scenario and the declining scenario. As you can see, if the pharmacy accepted the contract, it would make $106,745 in profit. Step 4 is the sensitivity analysis. This involves changing one or more variables and seeing how the change would affect the results. For example, it was assumed that labor costs were constant, but by changing the labor costs by eliminating a technician or reducing technician hours, this would greatly affect the income as well. And here are the results from the pro forma analysis for this specific scenario.
What other factors need to be considered? Could the contract be renegotiated? Other than prescriptions, what other goods and services do the pharmacy's Better Health consumers purchase? Just how many of the pharmacy's Better Health customers would leave if the pharmacy declines the contract? And how much business, both prescriptions and other goods and services, would they take with them?
The pharmacy manager knows that if she accepts the contract, the pharmacy risks sending a signal to other third parties that it will accept low reimbursement rates. The pharmacy may also have to raise its cash prices or decrease its level of service to decrease costs, but this may be necessary in either scenario. If she declines the contract, the pharmacy will lose long-term customers and may get a reputation for being a pharmacy that does not accept insurance plans. It may also have to reduce staffing hours, such as pharmacists, and it is unlikely that the contract could be renegotiated. Although Natalie could decline the contract and see how Belter Health Insurance responds.
Good Service Pharmacy will likely lose revenue in future because it will get less money per prescription if it accepts the contract and will lose customers if it rejects the contract. Are there any ways for the pharmacy to make up for the lost revenue? Are there any expenses that could be decreased?
Good Service Pharmacy can make up for lost revenue by either increasing services to increase their income or by decreasing costs. Costs could be decreased by carrying less unnecessary stock and by lowering labor costs wherever possible. It would be most beneficial for Good Service Pharmacy to make up for lost revenue by increasing their income. This could be done by services such as collaborative practice agreements. Collaborative practice agreements, also known as CPAs, are a form of patient care service that pharmacies can use to gain some revenue in most states. Almost all states allow some sort of CPA. However, the limitations of the pharmacist may vary. According to the Iowa Board of Pharmacy website, Good Service Pharmacy could potentially establish a CPA protocol with a provider that would allow them to order laboratory tests directly related to therapy management and assess certain physical findings such as vitals, oximetry, and peak flow, and authorize therapeutic adjustments to medications based on these findings in all situations except for Schedule II drugs. This may include therapeutic interchange of drugs or a change of dosage. The pharmacist would, however, be responsible for referring the patient back to the provider if they determine a finding that is outside of their scope of practice.
In the end, Natalie decides to continue to accept Better Health Insurance. The financial impact of losing 30% of the pharmacy's business was substantial, and she was not willing to lose Mrs. Anderson or other Better Health customers in the process. However, she's very worried about what other third parties will do in the future and how she can make it up her lost revenue. She decides that developing other sources of revenue is a better option for the pharmacy's future compared to reducing the pharmacy staff. So she decides to try to implement and obtain payment for some pharmacist services. This includes participating in any available Medicare Part D MTM services. She also hopes to expand the pharmacy's sales of durable medical equipment. Natalie plans on closely monitoring profit margins as other third-party plans move away from a WB-based reimbursement formulas as well. Thank you for your time.